So this chapter is going to talk about stress and self-management and time management. You've probably already been introduced to this pretty much during your nursing school career, and now as you going into preceptorships, or if you've already been to preceptorships, how to manage your time. And then stress. Stress doesn't go away. After you finish school, you'll be preparing to take your boards, and then you'll be working, and there'll be other stressors that come into your life. So how can we help to manage stress and time in the workforce? So when we manage ourselves, we need to think about how are we going to manage our stress? How about our time while we're at work or outside of work? And even when we're in meetings. Sometimes people feel like meetings can be very wasteful. Well, they can, unless you have an agenda and you know what needs to be done and covered, get in and get out. That's usually the best meetings. I'm not sure if you remember this from few semesters back, but it's the definitions of stress. And stress can be good, but then as it snowballs, that's where it can be bad. So a little bit of stress is good, like your first day at preceptorship, when you take your boards, when you start your first job. Keeps you on your toes. It's when it gets out of control and it builds, that's when it can be a problem. So when you get that first job, you're excited, and then the stressors start to set in. First of all, it's a change of routine, a new atmosphere, a routine at work. Family dynamics have to change a little bit when you go back to work. Different things like that. Then we have the social factors. You're not able to socialize as much as you were because you do have responsibilities with the job. And then whatever else might be putting a stressor on you. Your position and roles. What is it that I need to do? Who am I now? Am I the worker, or I'm the mom, or I'm the student? So you're changing there, and then you're coming into work and you're the new nurse. So a lot of things are changing. Women, when it comes to genders, women seem to put more stress on themselves than the men because we feel like we have to keep the household running as well as our jobs. And we feel like we need to do it all, and we don't like to ask for help. Men still have the stressors of being the breadwinner. So that can also pile up, making sure that you're doing what you do. And sometimes they feel like they might need to perform even more so and be stronger in the workforce than the females. And then you have your own internal sources too, and personal issues that may be adding to your stress. Some of the signs of stress are listed here. Someone having accidents, running into things, not paying attention, might be in some poor health, physically or emotionally. It's starting to get them down. They're not sleeping, not eating right, not taking care of themselves. It's really weighing on them. May become breathing and heart issues, abdominal issues, and so forth, headaches. Someone may start the unhealthy coping mechanisms to get through the stressful times. They're tired, they go to the bar, they get a drink, that might lead to drugs, smoking, overeating, and things like that. Absenteeism, they're not there. Even if they are there emotionally, they're not there. Mentally, they're not there. Turnover, this can be a lot of other issues that you're rolling over. You're maybe you're changing jobs. It's not, things, just too many things are changing, and you can't keep up. And you start one thing and then don't like it and go to something else. And then with work, people start to leave when it becomes stressful, and then it actually adds stress to the people who are still there. Then you have your decreased in quality of care outcomes, diminished productivity. And so, again, this can actually become an issue because of the poor care your patients are receiving, which can lead to more errors and more pressures put on the staff because of the errors, or maybe medication errors, falls, and so forth that are going on. Another sign of stress, or something that can actually increase stress, is because of the increased cost of insurance. A lot of people feel like they have to work just to be able to have insurance, which can add a whole nother set of stressors there. Some other signs of stress that might be out there might be a headache. Now, not every headache is due to stress, but sometimes we're feeling tired, and our brains actually hurt as a result of being overworked. So it can be a subtle sign of stress. Also, when you or a coworker repeatedly says, "I just don't care, you decide," or unless there's consequences, someone may even ignore those issues. Someone may be fatigued, have apathy, or disruptive behaviors, and just walk out, not show up for work, just kind of haphazardly doing their job. They're tired constantly, and this is, whatever kind of attitude. Stopper came out with five top stressors. One of these might relate to you, or many of them. Poor calendar habits. Someone who can't keep up with things, and so maybe they need to get a calendar and keep up and mark things, what's important, what's not important, what needs to be due, and when. On the other hand, someone may be stressed out because they have too many things on their calendar, and they get stressed out when they can't cover those things. Clutter can become a stressor. Think about when you've tried to find something at the last minute and you can't find it through all the clutter, and you're going through everything, and you're going through piles, and then you go through that pile again, and it can actually lead to more stress. Perfectionism. No one's perfect, and we have to quit trying to be perfect because we add more stressors to ourselves. Let things go and make sure that you cover just the most important things at this moment. And self-treatment. Giving yourself a me day or me time, and making sure that you do take care of yourself. And then following others' expectations. Sometimes we try to live up to others' expectations instead of our own, and that can lead to more stressors. So make sure you're going at your own speed and at your own pace. One of the best ways to manage stress is really trying to prevent it. And sometimes we don't realize we're under as much stress as we are until we actually see some signs of symptoms. So the best thing to do is to manage those symptoms in the best way possible, and maybe even seeing a physician, or just backing off and slowing down. Remember, when you graduate, you're a new nurse, and no one expects for you to be perfect and to know everything. So take your time and be patient with yourself. Another thing we have that happens to many nurses is called burnout, and I gave you a handout about burnout. And this is when the nurse is just done. He is feeling like they can't do what they set out to do, or to accomplish what they wanted to accomplish, and they sometimes just need to go and work elsewhere, find something else, especially if they start to get short. Have a short fuse with their patients and their coworkers. As you see on this side, some of the definition of burnout and some of our sources. And again, it's something that happens to people who usually work in a very stressful environment. Here's a few common characteristics of burnout that are out there. Physical exhaustion, mental exhaustion, and then emotional exhaustion. And sometimes when we become emotionally exhausted, that's where we get very cynical. We maybe have headaches and have complaints and aches about ourselves that really aren't necessary or aren't necessarily there. And then we start to pull ourselves away from everything, and detach ourselves from our patients and our coworkers, and those who are normally around us, such as our friends. Prevention is going to be the key, and it starts with choosing the right place to work. If you've had a bad experience during a clinical situation, you don't need to decide to work there to overcome this experience. You need to learn to move on. Figure out what the daily stressors are and then try to space them out and avoid them or find new ways to respond to them. Don't forget the physical stress that is just as damaging as the psychological stress. Insist on equipment in the workplace that helps you do your work in a correct and timely manner and actually prevents injuries. So here's some ways to prevent. If you look at this slide in the PowerPoints, many of these make sense, and some of these we've talked about before in classes. Here's some ways to resolve stress. A support system, whether it's friends, co-workers, other nurses, a support group, whatever it may be. A counseling, or maybe just your mentor or mentorship. Also going to conferences, talking about the stresses that nurses are under. We do have a very stressful job. And talk to your nurse manager. Talk to people who can help you to maybe back off a little bit on your workload. Another issue is management of time, and sometimes we feel like there's just not enough hours in the day. If we think of calendar management in the broadest sense, it really refers to managing the time we have in life to achieve what we want. Whether we're discussing calendars or schedules or hours or minutes, the key is that time easily escapes us. So you want to ask yourself these questions. Is this you? Is this what is happening? Is this why you are having difficulty with your time management? Being organized doesn't prevent interruptions, but they often can be accommodated. If you aren't organized, the smallest interruption can become a disaster. Be sure to use delegation to maximize your effectiveness. Know what needs to be reported back and be clear at the outset how you will keep apprised of changes in your patient's status. Multiple things will happen at once in clinical settings. So setting priorities and focusing on these keeps your goal and keeps you goal oriented. Whether you use an electronic device or a piece of paper, use some kind of method of tracking your own time. Sometimes we are so immersed in a situation that we lose track of time and then aren't sure what we need to do next. If someone wants to give you information, unless it is in response to a question you ask them to write it down and give it to you. When you become really busy, you may forget information that wasn't related to the situation at hand. I like this slide because it says, remember, everyone only has 24 hours a day to live. To live life. I better correct myself on that one. Successful people know how to use that time effectively for themselves, their careers, their loved ones, and their work. And that's hard to do. Sometimes, we're still all just figuring that out. But, we can make our lives easier in cutting out the things that do eat up our time. So here's some time management strategies you might want to think about when you're working. As I said earlier in the slides, managing meetings, agendas, and delegating. This is so important when you're in a meeting because you do need to go in with an agenda. That way you stick to the topics, what needs to be covered, and you know when you can go. Also setting a time and a time limit for the meetings, and then delegating people to have different tasks. And that way you're not overwhelmed and the meetings aren't going overboard and lasting too long, and then outside the meeting everything else is still going on, and then stress and time management becomes an issue due to the meeting. Lastly, again, remember delegation is a form of time management. So making sure that you do delegate wisely, making sure you delegate to the right person for the right task. Remember not to delegate anything that is within the nursing process, such as assessments and evaluations. Always make sure that you are clear about whatever expectations you have or anything that needs to be reported to you. And remember, you will be accountable for the actions, so making sure that you do follow up.